Hi, good afternoon, everybody. Good afternoon, colleagues. Good afternoon, professors and instructors. Um, this is um, this is GPH 747 Integrated Public Health Practicum, Summer 2019, AB2, by our instructor is Professor Richie Zavalata, and presented by Bernard Ogwere Meju. The topic of my presentation is evaluation of social factors and their impact on high teen pregnancy in New York City. Introduction. Teen pregnancy is a worldwide health issue with about 750,000 cases every year and 420,000 live births yearly. New York City is a city that's located in New York State, has 5 boroughs. The New York City has a teen birth rate of 13.2%. And when you compare that to the national birth rate of 18.8%, you can see that actually overall New York City is doing well with teen birth rate. But in New York City, there is persistent high teen birth rates in some districts of New York City. Irrespective of the overall good record, there are cities in New York City that district in New York City that have relatively high rates. In fact, sometimes it could double the state or triple the state and double the national teen birth rates. For example, in Bronx, East Tremont has a teen birth rate of 26.8%, while Bedford Park has a teen birth rate of 26.4%. Also, Morrisania, also in Bronx, has a teen birth rate of 30.0%. While in Brooklyn is part of the boroughs in New York City. In Brooklyn, you have East New York district with a teen birth rate of 37.1%. And also in Brooklyn, we have Brownsville, which has a teen birth rate of 30.4%. Increase in teen birth rates is common among Blacks and Hispanic population. In our study, we discovered that these areas that have increased teen birth rates are mostly areas that were inhabited mostly by Blacks population and or Hispanics. So it's also distributed in Bronx and Brooklyn. It is also good to note that Blacks and Hispanics populate more in Bronx and Brooklyn. This shows a peculiar geographic location, and it's found mostly in the increase in teen birth rate is found mostly in Bronx and Brooklyn, as earlier noted. While in Manhattan, Queens, and Staten Island, that are populated by whites, you have relatively low teen birth rate, which are in the same neighborhood or in the same range with the city of New York. Historical perspective. Um, Sometime in 2005, Healthy Female, Healthy Baby Initiative was kickstarted to reduce teen pregnancy. Then they continued it until 2008 when this program was expanded to accommodate sex education, community-based clinics, with training of providers to provide these services to the teens, and policies that mandated sex education. Presently, incorporation of social media apps apparatus to increase awareness was also included. Community government collaborations were mainly part of teams that make sure that teen pregnancy is taken care of. For example, in the Bronx area, we have what they call the Bronx Teen community linkage. This is a community outreach where the interior members of the community get access to healthcare services, especially among our target population. And our target population is between the age of 15 to 19 years old. We have this model, especially in South Bronx, which is working out very effectively, and also in other boroughs of New York City. The objective of this paper is to identify social factors and other health disparities that promote high teen pregnancy in New York City, and then also to identify socioeconomic factors and other health disparities that promote high teen pregnancy. And we're going to make an attempt to make recommendations for solutions of these problems, putting into consideration teen peculiarities or circumstances that increases teen pregnancy in New York City generally. That is the objective of this presentation. So, in conclusion, conclusion of the introduction, there is a persistent high teen birth rate or high teen pregnancy rate in some districts in New York City, as mentioned previously, despite the widely known low teen birth rate in New York City overall. So it's a silent point that needs to be addressed health-wise. And this teen pregnancy is commonly seen in populations that were mainly of Blacks and Hispanic origin. And there are associated other socioeconomic factors, including poverty, healthcare, poor healthcare access, and poor infrastructural development in those areas. We would attempt to promote expanded evidence-based teen pregnancy prevention strategies to curb these menace, and we'll also make recommendations for future use. Examples like family waiver protection policies, insurance confidentiality protection issues, improved healthcare access to these individuals, and increased use of contraceptive devices and access. And finally, universal basic insurance for all, because we discovered that most times these youths may not have parents that have insurance, they may have parents that are poor and no health insurance at all, so they completely lack access to healthcare and or opportunities to have contraceptive use to prevent such unwanted pregnancy. Risk factors. We found out that teen pregnancy in New York City, especially in those boroughs we mentioned above, were mainly seen within the age of 14 and 19 years old. And as I said earlier, especially among Blacks and Hispanics, with the associated poverty, low socioeconomic factors, and these adolescents will also have associated alcohol and substance abuse amongst them, and also high school dropout rates, because when they get pregnant and find it difficult to even feed themselves with pregnancy issues of pregnancy, they tend to drop out from school or tend to perform very badly in schools. There's also associated lack of social and recreational activities among these geographical location of these adolescents. They don't have anything that keeps them busy after school, and their social orientations are quite interesting. It is discovered that, according to Goldberg et al., that heterosexuals at higher risk have higher risk of teen pregnancy than lesbians. And in our studies, we found out that those we commonly found out that those that have problems of pregnancies are especially those that are heterosexuals in behavior. Socioeconomic factors. We're going to talk about the socioeconomic factors that promote these unwanted pregnancies among our teens. Access to healthcare is one of the major problems we discovered. Information. Most of these adolescents don't have information where to access these healthcare facilities or which providers to go for. And insurance issues also comes in there because most times they don't have the finance to support themselves to take care of their health care. So it depends on their larger families women that may not be able to afford those health insurance or those contraceptive pills and all those advices that they could get from providers. Another factor, socioeconomic factor, is family values, trust, pregnancy myth, cultural orientation, and education. These are factors that also affect teen pregnancy among our target group. Low income is another factor. Poverty, poor housing. We discovered that most of these things are overcrowded. Have poor housing. Most of them live in project buildings, and most of them depend on social welfare packages that cut across all aspects of life. Youth exuberance and experimentation is also one of the problems we discovered. A situation where young ones want to actually know what they can do with their growing, developed bodies, and so on and so forth. As I've mentioned, school dropout as one of the consequences as part of socioeconomic factors. Limited education is another one. Most of these adolescents' parents have limited education, and sometimes most of them have family social issues. Probably their parents are not living together, raised by single moms with so many difficulties in taking care of the needs of these adolescents. Another good important factor, socioeconomic factor, is peer group influence. They say bad groups do bad things. Most of these adolescents' parents don't really have time to look into their private lives to see the kind of people they move with, or kind of friends they make in schools or in social gatherings. Another factor is social media abuse. Most of these kids use social media for friendship and for boyfriends or girlfriends related matters. In so doing, they get to know themselves more privately, and they might get involved in sexual experimentation, and that might lead to unwanted pregnancy. Another thing we talk about is current efforts that is currently going on to curb this menace. Number one is there is this National Teen Pregnancy Prevention Program that was formed in 2015. The major target of this NTPP is to raise sex education among our target population and the acceptability of contraceptive devices. The second point is the New York City Teen Connection Program, TCP, or NYC TCP, which was also formed in 2015. And the target of this NYC TCP is on health education, which they individualized with involvement of the families, schools, clinics, and community centers so as to have a broader catchment area. Another one is Center for Health Equity in collaboration with New York City TCP, already mentioned above. They collaborate to provide evidence-based programs that help these teens to create awareness, get them educated, especially about their body changes, fears, and the hormonal changes that also prompt the sexual experimentation for them to be aware and take care of them instead of experimenting and at the end of the day they get pregnant. Another factor is another effort is a comprehensive healthcare services by the city and state. whereby contraceptive devices are dispensed with testing